Ego defense mechanisms. These are methods, usually unconscious, of managing anxiety by keeping it from awareness. Most times it may be adaptive or it could be maladaptive. Denial. Here, the client exhibits a failure to acknowledge an intolerable thought, feeling, or reality. For example, an alcoholic who says he does not have a drinking problem, he's in denial. Another ego defense mechanism would be displacement. Here there's a redirection of emotions or feelings to a subject that is more acceptable or something that is less threatening. For example, yelling at your dog when you are angry with your wife or your boss, that would be displacement. Projection, you are attributing to others your own unacceptable feelings, impulses, thoughts, or wishes. For example, saying you are angry or saying someone you are angry with dislikes you, you're projecting onto that person. So that would be projection. Undoing, an attempt to erase an unacceptable act, thought, feeling, or desire. For example, apologizing excessively. You're hoping you can undo what has been done. So that's an ego defense mechanism. Compensation, an attempt to overcome a real or imagined shortcoming. For example, a small person excels in sports. So you're trying to compensate for being short. That way you excel in the sport. So that would be compensation. Substitution would be replacing desired, impracticable, or unobtainable object with one that is acceptable or that you can attain. For example, marrying someone who looks like your previous significant other. So that would be substitution. Introjection. There's a form of identification in which there is a symbolic taking into oneself the characteristics of another. For example, blaming oneself when angry with another. So that's introjection. With repression, you want to force and keep unacceptable thoughts from awareness. The person will tend to say he's unable to remember, for example, a traumatic event. Reaction formation. Expressing attitude that is directly opposite to unconscious wish or fear. For example, being excessively kind to a person who is actually disliked. So that would be a reaction formation. You're expressing an attitude that is directly opposite to an unconscious wish or fear. Regression, return to an earlier developmental phase when you are faced with crisis or stress. Example, a child who has stopped bedwetting can go back to bedwetting or baby talking. Dissociation. Here there's detachment of painful emotional experience from your consciousness. For example, sleepwalking. There's also suppression, consciously putting a disturbing thought or incident out of awareness. Example, deciding not to deal with something unpleasant until the next day. You want to suppress it. And there's sublimation, substituting constructive activity for strong impulses that are not acceptable. So you are taking away impulses that are not acceptable and sublimating them or substituting them with constructive activities. In summary, some of the potential nursing diagnoses for clients who develop ego defense mechanisms would be individual coping ineffective and anxiety.